Hi, how are you?
Hi. How are you?
Good.
My name is Mickey. I'm one of Dr. Mendelssohn's nurses.
Hi.
You are Michelle
And I'm Teresa.
Nice to meet you. So we bring you in today to go over what to expect the day of the procedure, hopefully answer every question that you have.
Okay.
And just get you comfortable for the day of the procedure.
Good.
Okay?
Good.
We start off, I'm going to have you first look at each of your folders, Michelle. Just verify that your prescription, the address in these prescriptions are correct.
Okay.
So I can kind of take this folder back, but we'll let you look over your consent today. You're having the upper blepharoplasty. So go ahead and look over that. You'll, on the second page, list any allergies that you have, and then on the third page, you're going to sign date and time for today. You will also do it the day of the procedure, sign as well.
Okay.
And no allergies?
No.
And what medications do you take?
I just take Advil.
Advil?
Mm-hmm.
Like just as needed?
Yeah.
I'm going to use Teresa, your folder to kind of go over everything, and you guys can look over yours.
Okay.
And then I'll give you yours back, obviously, when you leave. So both, have you had your eye exam completed?
Yeah,
You have?
yeah,
Okay.
I just need to
I'll take-
go today actually,
And-
to pick up my
Oh, so
contacts
then-
and drop this off.
Perfect. So,
Yeah.
and then
Yep, I had
I didn't
2
put your
weeks
name,
ago.
just you can fill that
Yep.
in. Okay.
Yep.
You're both receiving antibiotics, or antibiotics. This is Caflex. It is to prevent infection. You will start this the day before the procedure. So on October 10th, start taking this. Take it 4 times a day until it's gone. It will prevent any infection. So hydrocodone acetaminophen it's a generic Vicodin, like a Norco. It's given, and you can take it a half to 1 tablet every 4 to 6 hours as needed for pain. I would also suggest just stocking up on extra strength Tylenol. Some patients get by with just taking that, which I think you're going to with an upper bleph. So, but we give you this just in case. Ambien is a sleeping pill if you need to take it to help sleep. So you'll take a tablet at night. Any questions about the prescriptions that you're given? So you'll get those filled prior to have for after.
So we're taking this 4 times a day for a week?
Yeah.
Okay.
Until it's gone, you'll take it. There's 28 tablets, so 4 times a day until it's gone. Even the day of the procedure, which I'm going to get to that. Okay, so we bring you in today to kind of go over what to expect. So on the day of the 11th, we'll call the week ahead of time and give you an arrival time. You'll come in, you'll check in at the front desk there where you did. We bring you back, we'll take photos. Because you'll come in with a clean face, no makeup on. We will do all of your photos. We'll take you back into a pre-op room where we will have you wash your face off with a special soap. And then you'll be given oral medication, so we'll let that work for a little bit. In the meantime, Dr. Mendelssohn will come in and talk with you, answer any questions that you have before we walk you into the procedure room, where you'll just have a blood pressure cuff on and a pulse ox on your finger. And he will then mark the site. That takes a little bit of time, and then he'll numb it up with a local anesthetic, and then we let that work for 20, 30 minutes. He'll come in, he'll start with your left eye, and then he'll go to the right eye. All right?
Do we have to take the medicine, the Valium and
You
stuff?
do not.
Okay, because I don't want it.
Okay, yeah. No, I mean, it's very simple procedure to
Yeah,
wear.
I mean, I had a tooth, I had an implant with nothing.
Yeah, with no numbing or
I had
anything.
the
Oh, I
numbing,
was going to
but
say,
no,
I was like,
they
oh.
offered the Valium
I was
stuff.
like, oh my goodness.
No, and I'm like, no, I don't
Yeah.
like that stuff. I
Yeah,
don't
no,
want to take it.
totally up to you.
And I'm driving myself
So
home,
just, you want to drive yourself home? We will be putting possibly some ointment in your eyes, and I mean, I would try to get it. I would see if you can you line up a driver?
Oh, I could, yeah.
Okay.
Yeah.
Because
I
we
thought-
recommend that you have someone take you back home, and if you're sometimes having a driver the next morning, if you've taken any pain medication,
Yeah, I'm not-
especially,
yeah.
or if you are blurry eyes. But if
Okay.
not, then
So
you're
there's
fine.
do they they put the drops in for what something in your
A
eyes
lubricant.
and-
If you're
okay.
when you're numb, you're unable to close your eyes sometimes,
Oh,
so
okay.
it dries out, and we would put like a lubricant
Okay,
in
okay.
there. So I'm going to just kind of go over this, but I just wanted to give you a rundown of when you come in the morning, where we take you, and kind of what to think through. But
Okay.
we'll touch base on everything as I go through these
Okay.
instructions, which you are going to actually take these home with you, everything that's in this folder.
Okay.
So we want to make sure that you get the best, result from your surgery, so try to follow these as best as possible. 1 month prior to surgery, if you smoke, just, smoking interferes with healing and the outcome of the procedure. So stop that. And patients having eye surgery need to have a complete eye exam, which we give you the information. You're going to have that done. 2 weeks prior, let us know of any medications or supplements that you take. So the Advil, we would say stop. Any fish oil, aspirin, things like that would cause extra bleeding, therefore result in bruising.
Right.
All surgical fees should be paid in full when we leave here. We'll stop at the front desk and touch base on that. The doctor's exams and test results ordered, that would be your eye exam, so you are aware that you need that.
Mm-hmm.
Avoid sun exposure. So this is 2 weeks prior and then also 30 days after.
Okay.
Make transportation arrangements the day of the procedure. So we recommend that you have someone bring you. It takes about 4 hours. You'll be here with the whole pre and post thing.
Okay.
And then they'll take you back home and bring you the next morning to a follow-up.
Our procedure's in the afternoon. Right?
Okay, so then
I
I'm not
think that's-
sure.
I think that's what we decided, right?
don't know.
I don't know either.
Yeah,
but
so I'm not
I-
sure on
'cause
timing, but-
I'm gonna work in the morning. I'll
Okay.
drive here and then I'll have somebody come get me.
Okay, great.
So,
I'm not sure on that part of it. We
Okay.
do the schedule a week ahead of time, but I'm sure it's
I think that's
probably
what they
set.
discussed.
Okay. You want to let us know immediately if you develop a cold, a sore throat, fever, blister, any skin eruption. It may not cancel your surgery, but we may have to order something extra for you.
Okay.
Discontinue taking vitamin E or any supplement containing vitamin E in excess to 200 IUs per day. We want you to stop taking aspirin, ibuprofen, Motrin, Excedrin. All of these you may only take Tylenol.
Okay.
All of this here is and you'll both take these bags with you today. Basically, it's just to help clean your incision sites after the procedure, so you're going to take those home today. You'll come in your next morning at your follow-up. We will actually clean the incisions for you. You'll go home and do that on your own. We'll just clean it with our supplies here. The day before the surgery, it says you have been given a prescription for an antibiotic. Begin taking it the day before. Take it until it's gone. It says exception, do not take the morning of the procedure if you're having anesthesia. Well, you're not having anesthesia, so you can actually eat and drink. Well, we will call you the week ahead of time and let you know your arrival time. We want you to wash your hair. Do not apply product. Remove all makeup, wigs, bobby pins, hair clips, jewelry, and any dark nail polish that would interfere with the pulse ox reading. Wear a shirt that buttons and zips. We just don't want you pulling things over the day of removing it the day of, and then 2 weeks after until everything's healed to interfere with us seeing that. You probably want to bring sunglasses when you leave because you won't even be able to tell you had anything done if you have sunglasses on.
Okay.
You'll keep your bottoms down on, so wear like yoga type pants, something comfortable. We'll give you little footies. Well, by then it may be cold, so who knows? Because now you come in shorts and so you'll put a little half gown on,
Okay.
And then we want you to eat actually a light breakfast because if we give you oral medication, we don't want you to get nauseous. So just something light, and don't drink a ton. You can drink, but not a lot so you'll have to get up and use the restroom the whole time. So any questions about preparing for the procedure and the day of? Post-op, every operation, is accompanied by a varying amount of swelling and bruising. Expect swelling to reach its peak at 36 to 48 hours. One person may have more bruising and swelling. You may have some. You may. We can't say. Everyone is an individual and heals at their own rate. So we want you to stay up as much as possible when you're at home, but rest when you're tired because the more elevated the head, the less swelling. And if you do, when you're sleeping, if you doze off to one side, that side may be more puffy, but once you're up moving around, it'll dissipate. Avoid bending over and lifting heavy things for 1 week. Sleep with your head elevated 30 to 40 degrees for 1 to 2 weeks. Sleep alone. Avoid anyone hitting your face, spouse, animals, children in bed. We also recommend that you begin taking if you do have to take the generic Vicodin, the Norco, for pain, it can cause constipation. So if you do take that, drink extra water and maybe even a light stool softener. We just don't want you straining your blood pressure raising and cause bleeding. The day of the procedure, we will give you the supplies that you will need to do your slush packs for your eyes. So you will receive a little basin that you'll put ice and water in. We will give you 4x4 gauze, and you will lay them over top of your eyes 20 minutes out of every hour. Okay? But that will be given to you the day of the procedure. We talked about the pain medication, extra strength Tylenol, or if needed. If bleeding occurs, you would go to bed, elevate your head, apply the cold compresses, and have someone call the office. Cleanse your suture lines above and below the eyes with peroxide and the Q-tip applicators that we gave you 3 times a day, and then we have you some bacitracin ointment in there for you as well. But we'll go over the day after. It's a lot we'll go over how to care for everything after. And then you will come in 1 week later to have your sutures removed. You may shower and wash your hair with a mild baby shampoo, which is provided in there the day following surgery. You will not have a dressing. The shower spray needs to be soft and not forceful. So just keep your head out of the line of the shower. You may blow dry your hair on a cool setting. Avoid pullover clothes for 2 weeks post-operatively. No swimming, golfing, or strenuous activity for 4 weeks. Returning to work depends on how physical and how much public contact you have. The average patient returns to work in 5 to 8 days. What about, do you color your hair, either one of you?
I do.
We generally say that about 3 to 4 weeks after. So a lot of people will schedule right before, so then they're
I'm
good.
gonna do it right before.
Yep. Your face may be gently cleansed. Do either one of you wear contact lenses or glasses?
I do.
Okay, so contact lenses may be worn 1 week after upper eyelid surgery. Eyeshadow and false lashes should not be applied until 10 days after surgery. You may tweeze your eyebrows 2 weeks following eyelid surgery. Avoid sun tanning your face for 30 days, so wear glasses and a wide brimmed hat while you're outside. And then I just kind of let you read over this last paragraph here.
Like an occasional hair here. and
Yes,
there.
I would just
That ain't
say
gonna
your
go for 2
incision
weeks.
line will run from here to here. So I mean, as long as you're not,
Yeah. Because I don't wax. I just.
yes, as long as you're just careful. And
The eyeshadow is what's gonna kill me.
I mean, you can like it says, you can just avoid right over top of.
Yeah.
You just don't want it to get infected and
Yeah, I
touching.
know,
Anytime
I
you
just
know,
don't go nowhere
yeah.
without my makeup.
you know that
Gosh.
anytime you have a surgery and you have an incision, just always have clean hands and
Yeah.
you know, things like that. So sometimes people are a little nervous, so they want a Valium to just knock the, you know. I don't think it's not painful, so
Yeah,
you're
I
not
mean,
going to
I
need,
don't-
yeah.
I may take it. I may not, just depending on
How you feel
when I
that day,
get here.
okay.
Yeah. You know. I mean.
So yeah, so we let you pick the type of music you want to listen to. We have Pandora in there, so think about that. And it's just a real relaxing environment. We will cover you with warm blankets and
Okay.
yep.
I'm good.
And usually, if we do give that medication, patients are usually, by the time injections happen, dozed off. But this is more too also for the advanced lift because it's a little bit longer procedure. And that's we typically maybe do a Valium for the upper bleph. So it's so simple. I mean, we have patients
Yeah.
come in who
Yeah.
they're like, I did it at an eye doctor and they gave me nothing. This
Yeah.
is nice. It's nice to offer the Valium if you are extremely
Yeah,
nervous.
Someone's really
Yeah.
nervous. Yeah.
Yeah.
So.
Okay.
All right,
Yeah.
so you'll get those filled, eye exam, and then keep reminding yourself of the do's and don'ts. Read over your pre and post,
Okay.
and your little goodie bags with all your cleaning
All right,
supplies.
Okay.
This
Thank
one's
you.
mine, you said?
Yes, I'll let you take that. Mhm.
Now,
So if I get my eyes lifted, I wonder if this will go away.
I imagine it will be.
I mean, I know this will go away, but I wonder if these little wrinkles will go away.
My inner eye is my big thing. I can't stand that.
Yeah.
This stuff right here. I
Yeah.
can't stand that. If that weren't there, I wouldn't be so. Because I've always had a little bit of a
Yeah.
not hooded eye, but I love my mustache in those pictures too. That looks lovely.
I had that taken care of too.
Yeah, I've never had a big eyelid area. I've
Yeah.
always kind of been hooded down.
I have too.
I don't have, so I don't want to have this big, eyelid area all of a sudden. You know what I mean? I
Yeah.
don't want to look not like
Not
myself.
natural.
So, yeah, that's fucking A. Just jealous.
Oh, look at mine.
And then that scar on my left from a pimple I kept picking at, I could kill myself for doing that because that just makes it more prominent. I know I tried to put a little bit of a smile on when she was taking those so I wouldn't look so nasty.
And she said not to smile. I kept smiling. She goes, no, don't smile, because I always smile.
My face is uneven too. This side drag, my left side droops down more. No supermodel symmetrical face there.